Hey there, and welcome to Echoes of Age. This is the place where we talk real stuff about getting older, in a way that helps you feel stronger, stay sharper, and live better every single day. We're diving into the things no one really talks about when it comes to aging, but should. Let's jump in, Ted.
Most people believe regular medical checkups are always the smart thing to do. After all, catching a disease early means a better chance at survival, right? But here's a truth that might surprise you: once you cross a certain age, especially after 70, some of the most common health screenings might actually do more harm than good. That's not an exaggeration. More and more experts in geriatric medicine are raising red flags about routine tests that were once considered standard. Tests that can lead to false alarms, unnecessary treatments, or even life-threatening complications, just because your body isn't the same as it was 30 years ago. In today's video, we're going to take a calm, honest look at 5 medical checkups seniors over 70 should think twice about. These aren't obscure or fringe ideas, these are procedures that even seasoned doctors are choosing to skip for themselves once they hit a certain age. We'll explore why these tests are still so commonly pushed, the hidden dangers they carry, and what safer, more age-appropriate options exist instead. Because your golden years should be about peace of mind, not fear, overdiagnosis, or recovery rooms. Let's begin. Number 1, colon cancer screenings, when prevention turns into pressure. Colonoscopies are often promoted as life-saving. And in many cases, they are, for younger adults. But once you're past 70, the math starts to change. Let's be clear, colon cancer is serious. But the procedure to screen for it, especially via colonoscopy, is far from simple. You have to undergo a full bowel prep, often involving strong laxatives, a day of fasting, and sedation. That's already a lot for the body to handle. But for older adults, it's even riskier. Many seniors experience severe dehydration or electrolyte imbalance during prep. And the sedation? It lingers longer, increasing the risk of confusion, disorientation, and falls, sometimes within hours of leaving the clinic. What's more troubling is what happens after the test. A small, harmless polyp might be discovered, something that would have taken 10 or 15 years to develop into anything dangerous. But the mere finding can lead to a domino effect of surgeries, follow-ups, or partial bowel removal. And for someone in their late 70s or 80s, all of this might never have been necessary. Here's a real example. Margaret, a lively 79-year-old who volunteered at her local library, agreed to a routine colonoscopy. She had no symptoms, but her doctor urged it. The result? A mild complication during prep left her severely dehydrated, and she collapsed in her kitchen the next day. That fall led to a broken hip and a long, painful recovery, all for a polyp that turned out to be benign. There are now non-invasive stool tests, like FIT or Cologuard, that are much safer and more appropriate for older adults. If you're symptom-free, these tests are worth discussing with your doctor. You're not ignoring your health by avoiding a colonoscopy, you're respecting the fact that your body has different needs now. Number 2, the illusion of the full-body scan. A full-body scan sounds impressive, doesn't it? One scan to detect everything wrong before it becomes a crisis. But this idea, though tempting, can be deeply misleading, especially after 70. Here's why: CTs and MRIs are extremely sensitive. They pick up every little blip, bump, and shadow, even things that are harmless and would have never caused a single symptom. But once something is seen, it's hard to ignore. Doctors call them incidental findings, small cysts, benign nodules, or tiny abnormalities that are totally unrelated to your well-being. But they still trigger concern. That concern leads to follow-up scans, invasive biopsies, and sometimes even unnecessary surgeries. One small, maybe, can turn into months of testing, fear, and recovery. For example, James, a healthy 76-year-old, was offered a discounted full-body scan at a health expo. It found a spot on his lung. He had never smoked, never coughed, and felt great. But fear took hold. That spot led to a biopsy. The biopsy caused a collapsed lung. The result? The spot was scar tissue, completely harmless. This is the danger of overdiagnosis. We treat something that never needed treatment. And we pay the price, in time, energy, and often quality of life. Full body scans are rarely recommended by major medical groups. They are expensive, not usually covered by insurance, and not tailored to seniors' unique risks. Instead, focus on targeted care, listening to your body, being aware of real symptoms, and trusting your intuition. Prevention should give you peace, not panic. Number 3, the misleading treadmill test. If you've ever had your doctor recommend a stress test, just to be sure, you're not alone. These tests, especially the treadmill kind, are often given to seniors during routine heart checkups. But after age 70, they may do more harm than good. Here's why: the aging heart behaves differently. Electrical signals change. Arteries get stiffer. And your heart might respond slower, not because it's sick, but because it's older. The stress test doesn't account for these nuances. The result? False positives. These false results often lead to invasive follow-ups, angiograms, catheterizations, and sometimes even surgeries like stents or bypasses, all in people who didn't have symptoms to begin with. And those procedures come with risks: bleeding, infection, kidney damage from contrast dyes, and long hospital stays. A good friend of mine, Evelyn, age 75, was convinced by her doctor to get a stress test after mentioning mild fatigue. She ended up undergoing a stent placement. 3 weeks later, she developed a blood clot and spent 6 days in the ICU. That mild fatigue turned out to be unrelated anemia. If you have real symptoms, chest pain, shortness of breath, dizziness, by all means, get evaluated. But if you feel fine, ask whether the test is truly necessary. Many doctors now use calcium scoring or less invasive monitoring as a safer option for older patients. You're not fragile, but your body deserves decisions that reflect where you are in life. Number 4, routine prostate screenings in older men. Prostate-specific antigen, PSA, testing is one of the most controversial screenings for men over 70. While it was once a default part of annual checkups, guidelines have shifted dramatically. The reason? Prostate cancer is often very slow-growing, especially in older men. Many will live their entire lives with it and never have a single symptom. But once a high PSA level is detected, the pressure to act begins. That action can involve painful biopsies, surgery, radiation, and all the side effects that come with it, like incontinence or impotence. All for a cancer that, in most cases, would never have progressed during your lifetime. Consider Frank, a vibrant 80-year-old who enjoyed gardening and hiking. His PSA levels rose slightly. A biopsy followed. Then surgery. The operation left him weak and unable to walk without assistance. What was meant to extend his life instead limited it. Medical organizations now discourage PSA screening in men over 70 unless symptoms are present. This isn't neglect, it's smart, personalized medicine. Ask your doctor, will this test change how we treat me? If the answer is no, it may not be worth doing. Number 5, bone density tests, the overreaction to osteoporosis. Bone density testing, or the DEXA scan, is often pushed on older adults to detect osteoporosis. But here's the catch: diagnosing low bone mass doesn't always mean treatment is necessary. Many seniors are told they have osteopenia, or early osteoporosis, and are quickly put on heavy medications, bisphosphonates or injections with serious side effects like jaw deterioration, heart rhythm issues, and severe bone pain. And yet, the real risk of fracture isn't just your bone score, it's your fall risk. Linda, 77, had a borderline DEXA scan. Her doctor insisted she begin treatment immediately. She developed joint pain that kept her from walking, which ironically increased her fall risk. All this because of a scan that didn't account for her active, healthy lifestyle. The truth is, lifestyle factors, balance, muscle strength, diet, and vitamin D, are often more protective than medication in mild cases. Unless you've had a fracture or are at high risk, it's okay to wait, retest in a few years, or simply focus on fall prevention. You deserve treatment that respects your strength, not one that weakens you in the name of caution. There's a quiet revolution happening in healthcare, a recognition that more testing doesn't always mean better care, especially as we age. You don't have to say yes to every scan, scope, or screening that's offered. Saying no doesn't mean you're ignoring your health. It means you're practicing wisdom. Ask questions. Know your body. Prioritize your quality of life. And most of all, trust that after 70, the goal is not just living longer, but living well. If this video gave you insight or reassurance, please let us know in the comments. Just type number 5 below to show you stayed with us to the end. And don't forget to subscribe for more empowering, age-smart wisdom every week. Your journey matters, and we're honored to walk beside you. Take care, and we'll see you in the next one.